Knox County Health Department reports another death due to COVID-19, the 10th in the county since the beginning of the month, which brings the total number of deaths to 46. That there are 85 new confirmed cases since yesterday. There have been nearly 4,800 cases of coronavirus since everything started, and there are 163 probable cases. Just over 2,600 people have recovered. Now, almost 2,300 cases are active right now, and 27 Knox County residents are in the hospital. Also today, the health department giving us more perspective on the clusters of COVID-19 cases, seen more and more as the outbreak is rolled on, but clusters are still not the main way that the virus spreads. Clusters are when two or more cases are linked by the same location of exposure to the virus. It's different than community spread, which happens when people are not sure how or where they became infected. The health department looked at data for clustered assisted living facilities, restaurants, construction, and other categories. But the category with the highest number of clusters was community. Now, again, not to be confused with community spread. This kind of cluster includes get-togethers and parties, as well as educational or church settings.
You can see the most frequent reported cluster setting is community. Activities such as barbecues or dinner parties are clusters that are also identified and classified under community. Back in the early stages of the pandemic, we didn't see very many clusters. Since mid-June, those numbers have increased. The big takeaway here is that clusters are occurring in a variety of places, and they do not make up the majority of our cases. Community spread does. Your risk of getting COVID-19 is present all across the community.
Dr. Martha Buchanan once again continuing to urge people to follow the 5 core actions that include wearing masks and keeping social distance.